Hi, I'm Shannon McConville, and I study health policy here at PPIC. Today, I'm going to be talking to you about the Affordable Care Act, federal health reform, whose major provisions will begin in about 1 year. California is home to more than 7 million uninsured people, the largest number of any state, and that number is expected to be cut in half as the result of the ACA coverage expansions. First, I will outline a few key provisions of the law. Next, I will highlight what the changes will mean for Californians. And finally, I will discuss some of the looming questions moving forward. Some parts of the law have already taken effect, like children with pre-existing health conditions cannot be denied insurance coverage. Young adults can now stay on their parents' family coverage up until the age of 26. And health plans must provide certain preventive services, such as mammograms and well baby visits, free of charge. But most of the major policy changes brought about by the ACA will begin in 2014, including the requirement that most people have health insurance coverage or pay a tax penalty, often referred to as the individual mandate, the requirement that health insurers offer coverage to all people regardless of age, health status, or pre-existing health conditions, and the requirement that employers with at least 50 employees contribute to the cost of coverage for their employees. Taken together, these changes are intended to greatly expand health insurance coverage. In California, some of the biggest changes brought about by the ACA involve new options for low and moderate income families to secure health insurance coverage. These rely on state-level implementation, but the federal government will provide the bulk of financing to cover the costs of these coverage expansions. Medi-Cal, California's Medicaid program, which offers comprehensive health insurance coverage to low-income families and qualified individuals, will be expanded to include people with an annual income of about $32,000 for a family of 4. All citizens and legally residing immigrants who have been in the U.S. at least 5 years will be eligible for these coverage expansions. California's new health insurance exchange, called Covered California, will open in October of this year. Covered California is a new online marketplace where individuals and small businesses can purchase health insurance coverage. It's designed to make it easy to shop and compare health plans based on benefits and costs, with the goal to provide more affordable, high-quality options than are currently available in the market. And the federal government will provide subsidies for low and moderate income families to purchase coverage through the exchange. To facilitate enrollment, the law also requires states to streamline eligibility and enrollment systems and offer an easy and straightforward process for people to enroll in the coverage programs they're eligible for. While it's difficult to know how much these coverage expansions will change things, most estimates suggest between 3 and 4 million uninsured Californians will gain coverage through these coverage programs. Moving forward, there are still many unknowns, and several decisions that both state and federal lawmakers must make in order to implement the changes from the ACA. Some of the big questions revolve around the healthcare workforce. Will there be enough healthcare providers to serve those newly insured, and will they be located in areas where they are needed? There are questions about the affordability of health plans offered in the exchange. While the maximum amount a family would pay is set in the law, it is still not clear how much these plans will cost, nor how willing or able people will be to pay for them. And there are still big questions around how many people will remain uninsured. Despite coverage expansions, 3 to 4 million Californians are expected to remain uninsured even several years after ACA implementation. So there will still be a need for the safety net providers, such as community clinics, that provide services for those that remain uninsured. Although there is still considerable work to be done, California has committed to the coverage expansions provided for by the Affordable Care Act, which over the next several years should connect millions of Californians to health insurance coverage. Thank you for listening.